Okay, I'm going to start with infection control, and I have my supplies. I have my stethoscope and I have my pen light. My name is Rachel. I'm going to be your nurse today. Do you have any assistive devices?
No.
Do you have any pain?
No.
Can you tell me your name?
Sarah.
Can you tell me what day it is?
Monday.
Can you tell me the president?
Obama.
Patient is alert and oriented times 3. I'm going to give you 3 words to remember for the end of this assessment. It's going to be couch, bed, and rug.
Okay.
So I am going to start with your head. I'm going to look at your hair. Your hair is evenly colored. No signs of alopecia or hair loss. It's evenly distributed and even thickness. I'm going to check your skin. It's evenly moistured. The skin color is, skin moisture is good. The temperature is warm to the touch and it's evenly pigmented. I'm going to look inside your ears. They're evenly sized and symmetrical on the body. There is no extra cerumen. There is no drainage. I'm going to look at your other side. No abnormalities. I'm going to now look at your eyes. Your conjunctiva is a pink color. Your sclera is white and clear. Your irises are evenly colored. I'm going to check your pupils. Your pupils are equally reactive and accommodate to light. I am now gonna, your eyelashes are evenly spaced in thickness. Your eyebrows are also symmetrical on the face and thickness. I'm gonna look in your nose. Your nares are set bilaterally. There is no abnormalities. Your nose is set symmetrically on your face. Can you breathe in on one side and do the other? Your nares are set symmetrically and you are able to smell. I'm going to now check into your mouth. Your mouth is a pinkish in color. Your tongue is set in the middle. There are no signs of dental cavities. Can you stick your tongue out and say ah? Your tonsils are set and right size, no swelling or redness. Your uvula is midline. There's no odor coming out of your mouth. I am now going to palpate your sinuses. Can you tell me if there's any pain? I'm palpating the frontal sinus and I'm palpating the maxillary. I'm now going to palpate your lymph nodes. Your lymph nodes are not palpable, no swelling or tenderness. I'm going to do your trachea and thyroid. No, your thyroid's not palpable. It's set in the midline. There is no tenderness. Can you swallow for me? Swallowing is intact. Can you open your mouth for me? No signs of TMJ. Can you move your neck around? Your neck you can move your neck, which is good range of motion. I am now going to palpate your chest. There's no masses or abnormalities or tenderness. I'm going to palpate your back. There is no tenderness, no masses or abnormalities. I am now going to can you take a deep breath in for me? Chest expansion is good. No trouble breathing in or out. Patient is able to take a deep breath. Now I'm going to listen to your lung sounds anteriorly or posteriorly. You take a deep breath in. Another one. One more. Patient is able to take a deep breath in with no trouble. There is no wheezing or crackles when she does so. I'm going to listen anteriorly to your lung sounds now. Take a deep breath in. Can you take a deep breath in? Lung sounds are good anteriorly. No wheezing or trouble breathing or no crackles. I am now going to listen to your heart sounds. And I'm going to start with your aortic in your second intercostal space. And your pulmonic in your second intercostal space. I'm going to move down to the third intercostal space. Your fourth with your tricuspid. And your fifth intercostal space with your mitral. Heart sounds are strong and intact. No signs of murmurs. No trouble with your heart functioning, which is good and normal. I am now going to check for crepitus in your shoulder. No signs of crepitus in your left shoulder. No signs of crepitus in your left elbow. Check for crepitus in your right shoulder. No signs. And in your right elbow, no signs of crepitus. Can you move your arms around? Your range of motion is good. Can you stick your arms out? Don't let me push down. Don't let me push up. Muscle strength in upper extremities is strong. And I'm going to check your capillary refill. Refill is less than 2 seconds. The skin in your upper extremities is warm to the touch. There's good skin turgor. It's moist and evenly colored. I'm going to check your radial pulses. Radial pulse is strong and present. I'm going to check your carotid pulse. Your carotid pulse is strong, no weakness. I'm going to listen with the bell. Pulse is strong and present, no abnormalities. I'm going to now have you lay down for me. And I'm going to inspect your abdomen. And there's no signs of striae, edema. There's no swelling or inflammation. No abnormalities. I'm now going to listen to your bowel sounds in all 4 quadrants. Bowel sounds are present in all 4 quadrants, not too much but not too little, and no abnormalities with the bowel sounds. I'm now going to listen to the vascular sounds, starting at the aorta, you move to the right iliac, and the left iliac, and the right renal, and the left renal. Vascular sounds are present and strong, no swishing or abnormalities. I'm going to now palpate the abdomen. Is there any tenderness? No. No tenderness or masses or abnormalities. Can I have you stand up for me? I'm going to check for crepitus in the hip. Can you move your hip out? Can you move your knee? No crepitus on the left lower extremities. Can you move your hip out? Can you move your knee in and out? No crepitus in the right lower extremities. Can you move your leg out? Range of motion in the lower extremities is intact. Can you sit down for me? Can you lift your leg out? Don't let me push up. And the same. Don't let me push up. Muscle strength in lower extremities are intact. Skin is warm to touch, good color, good moisture. I'm going to check for capillary refill in your toe. Less than 2 seconds on both feet. I'm now going to check your dorsal pulse and your posterior tibialis. Pulses on feet are strong and no signs of weakness in the pulse. Can I have you stand up for me? Can I have you walk to the bed in the back? Patient's gait is intact and good, no signs of swaying or limping. Can I have you stand on one foot? Can I have you stand on the other foot? Patient's balance is good and intact, no swaying or having trouble standing. Can you close your eyes for me? What? And I'm going to touch a body part. Can you tell me which one it is?
My left arm, my right leg, my left foot.
Patient sensation is intact. Can I turn you around? And can you bend over for me? I'm going to palpate the patient's spine. The patient's spine is symmetrically bilaterally. There's no signs of scoliosis, chordosis, or lordosis. You can stand up now. Can I have you smile for me? Can I have you puff out your cheeks and raise your eyebrows? Patient's cranial facial nerves are intact. Can I have you go like this? Patient's fine motor skills are intact along with gross motor skills by moving. Can you recall those 3 words I said to you?
Bed, rug, and couch.
Patient's short-term memory is intact. Can I have you do the 6 cardinal fields of gaze? Can you follow my pen light? Patient's 6 cardinal fields of gaze is intact. The vision is intact. And I think we are done.
All right.